Okay, so it looks like my first attempt at being live, I was logged in under my account instead of the Carrollton Animal Hospital account, so not everyone could see me. So we're back. We'll get technology figured out the more we do this. So I guess to kind of recap, I started out with a little story about Bailey, who came in here. She was really cute, Cavi. She ended up having a nasty uterine infection called a pyometra, for those who missed the story about her. To kind of summarize, so for people who did see it, we don't have to go through the whole thing again. Pyometra is a really nasty uterine infection, and it can be extremely life-threatening because the infection in the uterus can jump into the bloodstream itself and cause a blood infection called sepsis, and that's the real danger there. Bailey ended up having emergency surgery to remove her infected uterus, and no news a lot of times is good news in our industry. As far as we know, she's doing really well at home. When she left the clinic here, she was eating and drinking on her own, but she was still definitely recovering from the surgery. She was quite sick by the time she had her surgery. And as a segue with that, it takes us to why we wanted to talk about spaying and neutering. If you're not going to breed your pet, a life-threatening condition like a pyometra is something that is very easily avoided, along with other reproductive issues like cancers and prostate issues and things like that. To kind of try to stay back on track here, if anyone has questions about that, if you're just joining, then feel free to text it in and I can go into more detail with Bailey specifically. But we did have some questions submitted ahead of time. Big one is, what is the difference between spaying and neutering? Spaying and neutering are colloquial terms that kind of refer to medical terms. So a spay in America is an ovariohysterectomy, where we remove both the ovaries and the uterus itself. And so that sterilizes the female. And then a neuter is a castration, typically referred to in males, where we remove both testicles. Because typically we do leave the scrotum itself, so they will have their sac, but it tends to shrivel up and get smaller once the testicles are out of there. But it is the actual removal of the testicles themselves. So that's kind of your difference. One's essentially a sterilization for a girl, the other's a sterilization for a boy. If you ever get on like a trivia game show host, I'm not sure what they'd ask, but in America, a spay is an ovariohysterectomy, which removes both the ovaries and the uterus, while in Europe, a spay is just an ovarectomy. So they actually just remove the ovaries and they leave the uterus there. It has the same effect of sterilizing the female. They can't get pregnant, they do not cycle, but they go ahead and just leave that uterine tissue in there, and it tends to shrivel up a lot like the scrotum does in our intact or our castrated male dogs after you remove the testicles. So how long does it take for dogs and cats to recover from being spayed or neutered? The exact time will depend a little bit on how old they are when they get fixed. Typically, the younger they are, the faster they recover. When you're young, you just heal faster. Generally, as kind of a general base, we usually tell people to try to keep them quiet for about 3 days. At our clinic, we automatically send home 3 days worth of pain medications for our female dogs and our male dogs as well, to kind of help with keep the inflammation down and help with that initial stage of recovery. It's just going to get the body on a good jump start. After that, you don't really have to do a whole lot of exercise restriction. Everything should be fully healed regardless of the age of the pet after 2 weeks. For your young pets, it's pretty much done healing at 7 to 10 days. We do ask that they don't try to jump over a couch and not make it. You get some direct trauma to an incision site, things like that. But generally after those first 3 days, you don't need a whole lot of exercise restriction. The exercise restriction helps a lot with the males. Because we simply remove the testicles out of the scrotum and leave the scrotum there, there is a lot of what we refer to as dead space, or basically it's an empty sac, okay? There's a bunch of little capillaries or blood vessels on the inside of that sac that can bleed, okay? And if they're running around a whole lot, and it will fill up that sac and essentially make it look like they regrew their testicles. It's just a blood clot. It typically does not cause any major problems, but it does make it take a little longer to heal because the body is going to have to reabsorb that blood clot. And if it gets really tight on the scrotum itself, it can cause some discomfort. And then that would encourage licking, which can lead to a skin infection if they do lick at that site. So that's the other thing with these surgery sites. We don't want them to lick at them because their saliva, everything will get you that secondary skin infection, and then they're going to need some antibiotics. And if it goes untreated, there's potential it could cause the sutures to fail. So kind of general surgery care, you do want to kind of keep them away from the site. A question we just got is the surgery painful? So there is definitely pain involved with surgery. We try to stay on top of it. We're extremely proactive with our pain medications. We give everybody who comes in for surgery an injection for inflammation and pain the morning of, before they ever have any trauma caused at all by scalpel blade or anything. And that's going to get it on board. Almost like the recommendation that some people have of taking an Advil before you go get a shot yourself. Okay, so if you have that anti-inflammatory on board before there's any trauma to any tissues, it's going to make it a lot less painful moving forward. Pain meds work better if you're not trying to play catch up, if you're starting ahead of the game. So everybody gets those. And then we also send home 3 days worth of pain medications, like I said, automatically for our dogs. It is an option we offer for our female cats. We don't make it automatic because we do a lot of barn cats here, and these cats are semi-feral. Everybody gets the pain injection, but a lot of them you won't ever catch again. So we do offer that 3 days of pain medication for the female cats to go home, but it is something that isn't automatic because we can't always guarantee you can catch them again. The male cats, the pain associated with it, it seems like that initial pain injection is more than enough. It's a very simple surgery for them. They don't seem to be affected by the pain of it at all. Most of the people don't seem to have a problem with managing the pain. We haven't had anybody say that their dog was just too painful. Is there another question? Will my male dog become less hyper once he gets neutered? So what happens, particularly with our male dogs, is you're going to remove that hormonal drive to marker territory, that hormonal drive to defend your territory, that hormonal drive to go run after all the girls, okay? If you have a hyper dog to start with, who's just hyper in general, like, ball crazy or anything like that, they're going to stay that hyper because that's not affected by their hormones. What is going to happen is they're going to calm down with all those things that are hormone driven. So a lot of people do see their dogs settle down, but that's mostly because they're not worrying so much about the neighbor dog next door trying to get in on their females that they smell 5 miles down the road. They're not worried about trying to run and go catch this girl because she's in heat 10 miles this way and then run over this way to try to get the girl who's in heat 3 miles that way. So a lot of times they do calm down in the sense that they're not going to wander as much. Is it a guarantee? So if your dog is already doing all these behaviors, will it stop once they get neutered? At that point, the statistics on it are about 50-50. The hormonal drive is gone, but the dog, it's also a bit of a learned behavior. And a lot of them like wandering. And like I said, if you have a very hyper dog to begin with, they're still going to be just as energetic and happy and driven for all the things that aren't related to being what is hormone driven or sex related, essentially. Looking for females, trying to procreate, those types of things will settle down. One thing of note that a lot of people don't necessarily think about when they do remove the reproductive organs of their pet is that your base metabolism will slow down when you do that. The body isn't cycling. Males, you don't think of them as cycling, but they actually do. Their cycles are just very short and quick, and they're kind of continual. They're always reproducing more sperm, okay? And it's a short, quick cycle when they do that. So even the males are expending energy doing that, and the females are expending energy coming in and out of heat. It's a little bit more visual, and you can see that. So that does go away. So the base metabolism does fall. And so what I tell a lot of owners is, you spend some money on a surgery, you end up getting to save money on food for the rest of the life of the pet. You just feed them less. It's not a problem. They seem to do really well. And yeah, so you can see some change in hyperactivity. especially if it is territorially or hormonally driven. It's not a guarantee. But as far as your pet still loving to play ball and still being just as enthusiastic to go hunt rabbits and things like that, you shouldn't see any difference whatsoever. Is neutering easier than spaying? Yes, actually, from a certain perspective it is. And that's mostly just because of anatomy. It's easier to get to the testicles than it is to get to the ovaries. The ovaries live right up here, right next to the kidneys, okay? And so you do have to go into the abdomen, kind of go up next to the kidneys, bring those ovaries up, make sure they're ligated out really well, remove them, and then we here come all the way down the uterus itself to the cervix and remove it at that point and take the thing en masse. So it's a lot more involved because you have to go inside the body to get it in order to take care of it. The testicles are already out there, so you can access them very easily. You just have to go through the skin. You don't need to move any other organs out of the way. You don't need to watch out for any intestines or extra blood vessels that could potentially get in the way and things like that. So neuters tend to move faster, and the surgery is a bit less invasive because you're not actually entering the abdomen. You're just simply going through some fascia and skin there. So yeah, it is a lot easier to neuter a male than it is to spay a female. And so the recovery time on the males typically ends up being a bit shorter just because it is less of an involved surgery. I think we're caught up with those. So what is the best age to spay or neuter dogs and cats? That's a question I get asked a lot. It really kind of depends on the breed and the adult size as for our recommendations come in at this point. So as kind of blanket general things, if your dog is going to be over 50 pounds of its adult weight, their recommendation now within the industry is to spay or neuter them at sometime between around 8 months to a year. If your dog is going to be less than 50 pounds at their adult weight, then the recommendation is to get them spayed or neutered between 6 and 8 months of age. If you have a cat, the recommendation is to get them spayed or neutered sometime between 4 and 6 months of age. So a lot of this has to do with rate of maturity and aging. What they've found, and the reason that it went from being a recommendation in general for all sizes and species to a little bit more broken down that way, is within the veterinary community they found that if you did early spay and neuter on your large breed dogs over 50 pounds, they had a higher chance of becoming urinary incontinent when they got older. Okay, so trying to avoid that, we're doing them a bit later. They mature later, so you don't have to worry about them necessarily starting to cycle as much, so you don't have to worry about them having that more of a predisposition to reproductive cancers. If you wait until your pet gets old to spay and neuter them, it does still decrease your risk of development of reproductive cancers, but it's not nearly as effective of preventing those as it is if you do them when they're younger before they've cycled a bunch. At what age do unspayed female cats and dogs start giving birth? So again, this kind of goes back to what breed are they and everything. Cats are a little bit easier just because we don't have, unless you are into purebred cat breeding, the majority of cat questions are going to be for your basic domestic short hair or mutt cat, so to speak. So they're a little bit easier because we haven't played around as much with their genetics. The cats, the earliest that they can start giving birth would be, how early do they start cycling? And the earliest I've seen is right around that 5 and 6 month mark. A lot of times it's not like a full true cycle. It was a female that got caught when they first started going into heat. Usually it's like a 1 or 2 kitten litter. The female is usually very small. It does stunt their growth. In our profession, we almost refer to it as like a date rape litter because usually it's in an area where there's a lot of cats and they're usually litter mates that end up breeding each other. So that's the earliest I've seen for a cat. but that's where that recommendation of getting them done between 4 and 6 months comes into play. As far as dogs go, there have been some small breed dogs that will start cycling and being fertile at 6 months, usually more for the males with the small breed dogs than the females. So you have to kind of watch the little males, because they'll go after the girls a lot sooner than necessarily the little girls will start accepting a male as far as dogs go. But again, that's kind of your 6 months is the earliest what we've seen that, usually more males than females. Your larger breed dogs, again, it's usually later, and it has to do with that maturity. How quickly are they going to mature? How quickly are they going to start cycling? So it's very variable. We've got a little bit more variation within the dogs necessarily than the cats. We got another question. How much does spaying and neutering cost? So that depends again on the size. So a lot of that is determined by how much drugs do we need actually to effectively spay and neuter your pet. I don't remember our prices off the top of my head. I probably should have had that prepared, but rough estimates, I believe, at least at our facility, a cat neuter is around $100. That includes anesthetic, pain medications, surgery itself. A cat spay is $200 and some. Again, that's all included in our prices. And then the dogs, it's broken down by weight. So, and I'm not even going to guess on those as far as what the price is. But a lot of that cost has to do with how big is your pet, how much medication is it going to need for us to effectively do the surgery. And then once you get over a certain size, you start adding in, it does take a bit longer to actually perform the surgery itself. But the vast majority of the cost associated with getting an animal sterilized is to do with the medications of knocking them out and then their pain medications as well. So if I would say for a better idea of what does it cost, just give us a call. The staff are more than happy to just plug it in really quick based off of the pet's weight and let you know what it would be. And as I mentioned, with all of our costs that we include the pain injection the day of, the anesthetic, the surgery itself, and 3 days worth of pain medications to go home. That's all included in that estimate for dogs. My dog has recovered from parvo. How long should I wait for her to be spayed? So if your dog's fully recovered from parvo, you should be ready to go anytime. The biggest thing with wanting to wait until they're fully recovered is processing the anesthetics. So if your pet is sick or still has some residual effects from the parvo itself, then you're going to want to hold off until that's gone so that you know that the kidneys and the liver and everything else is recovered, because parvo is a virus that doesn't just attack the GI tract, it affects the entire body. And so you want to make sure that entire body is back up to par and able to process what needs to be processed as far as the anesthetics go and ensure a safe recovery. But I would say if you have any questions about that, if you're not sure, looking at her at home if she's fully recovered, you can always, do a quick exam. But most pets, once they start eating, drinking, going to the bathroom, running around like idiots again, they're usually pretty good. And so there shouldn't be there's no specific time, I guess, that I can give you for, if your dog gets diagnosed with parvo, you should wait this long for it to be fully recovered, because it's very individual for the pet. Parvo wasn't really a topic of discussion, but it is a virus that affects the GI tract, primarily in puppies. It causes the lining of the GI tract to slough, okay, and it causes really nasty diarrhea. It can also be life-threatening, primarily through dehydration, but because you are sloughing that lining of the GI tract, it can take you into a sepsis state as well, which we talked about a little bit with our initial case with a pyometra. So you do want to make sure you are fully recovered from that, but because it's a virus, it's going to run a slightly different length of course in every single individual animal, and it's going to run a different length of severity or a different measure of severity in each individual animal. So unfortunately, I can't give you a blanket recommendation for diagnosis and then full recovery, because it is very individual. Does spaying and neutering prevent cancer in cats and dogs? Yes, it does. And that's part of the reason why we recommend spaying and neutering pets if they're not going to be used for breeding. Is it 100% prevention? Not really, and it kind of depends on how old they are, but it gets pretty darn close, especially if you spay or neuter them prior to their sexual maturity age of fully cycling. If you get a female, for example, a female dog before she's ever had her first heat cycle, your chances of developing a mammary cell carcinoma or anything like that is less than 10%. And it, however, if they go through even one heat cycle, then that percent goes a little bit higher of them developing it. As I don't have the exact numbers, but I do know that it is definitely in the single digits if you get them prior to their first heat cycle, and then it goes up just a little bit each time they go through a heat cycle. And it just goes incrementally up. So the more heat cycles they have, the higher it goes up there a little bit. That's why if you have your older bitch that's had a bunch of heat cycles, you can spay her, and it is still going to decrease that risk a lot of her developing a mammary cancer. But it's not going to make it as close to zero as we would like, okay? But it is going to remove all those hormones and everything that can affect that mammary tissue and bring on essentially breast cancer. So it is very effective. It does help a lot. If you wait until they've actually developed a lump in their breast, which some people do, and then you choose not to remove that lump or anything like that, then your chances of it developing into something more is obviously higher. So it depends on when you do it. But yes, it can definitely prevent a lot of cancers. And in the males, there's testicular selenomas, which, regardless of age, that has 100% efficacy of preventing, because we actually remove the testicles when we neuter them. The other cancers that spaying a female would have 100% efficacy of preventing are like leiomyomas and leiomyosarcomas, which are cancers of the muscle of the uterus itself. Again, because we physically remove that from the pet. So yeah, it'll decrease the chances of reproductive cancers associated with the tissues related to reproduction, and it will completely remove 100% prevent the cancers that can get associated with the tissues that we physically remove from the animal, because they're no longer in there. So kind of a complicated answer, but nothing is ever simple. There's always gray areas, I guess, so to speak. I recently adopted an older dog. Is the dog ever too old to be neutered? So a lot of that has to go with anesthetic risk. Okay, so you would probably want to kind of see how he's doing. If he's not having any problems and he's old enough that we're going to worry about him processing the anesthetics, then we're probably going to tell you just to let him go. And if he develops a problem, like one of his testicles swells 3 times larger than the other one, or he has trouble going to the bathroom because his prostate is enlarged, then we're going to recommend neutering him at that point. But there's no benefit that is greater than his risk of anesthesia if he's doing perfectly fine otherwise once they get over a certain age. So that's kind of what is that magic age where the risks of anesthesia outweigh the benefits of castration. It depends on the breed, and it depends on the individual dog. So it just has to do with how they process things. And if they're on the edge, a lot of times we'll recommend running some blood work and getting a look at their organ function on the inside and using that to help us determine whether or not the benefits of castration would outweigh the anesthetic risks. So just kind of one of those individual things. There's unfortunately not a clear black and white answer for you with that either. Kind of depends on the pet. So, my pet just gave birth. How long should I wait to spay? So that's something that we'll see. We usually say if they just give birth, we like the animals to be the kittens or the puppies to be completely weaned. Typically, it takes about 8 to 10 weeks for a female dog's uterus to kind of come back to normal after giving birth. For a cat, you're looking usually closer to the 8-week mark for the uterus to come completely back to normal. The one caveat I'll say, especially with cats and even with dogs to some extent as well, is they do not have to be fully weaned for them to cycle again and get pregnant again. A lot of times when they give birth, they can do something that's called short cycling, so they don't take as long in between their cycles before they get fertile again. And while nursing does help to kind of hopefully keep them from cycling too much, a lot of them can potentially short cycle and they can get pregnant even while they're still nursing. So if you have a bitch or a queen that's nursing, you do still want to kind of keep them away from the males, especially if you're planning on getting her fixed. Got another one. This is going to be our last question today. How should I prepare my home after my pet is spayed and neutered? Is there anything I should buy after the surgery? So as far as preparing the home goes, there isn't a whole lot that you necessarily have to do. Mostly what we're worried about is keeping them, like I said, try to keep them calm for about 3 days. So that's a lot of leash walking. You typically don't have to keep them from going up and down steps. We do ask that you try to keep them calmly going up and down steps. So if they're a darter that just likes to race up and down the steps, then maybe put a baby gate and just walk them calmly up and down the steps, just to help kind of minimize that activity. If you have one that's a couch jumper or a couch surfer and likes to leap, well, if they miss right after they've had a surgery, that could be pretty bad. So maybe don't let them on the furniture for a while until that incision's fully healed. We want to avoid trauma directly to that incision. The main complications that I've seen from overactivity and trauma are from our pets that are very, very active. I had one that didn't make it very far down the road, and he had to come back in because he was in the car and he was trying to, it was a big SUV that had 3 rows of seats. They put him in the middle row and he was trying to jump over to the back row and then back into the middle row while his owner was driving, and he didn't make it. And he got caught and he just tore open that incision. So they didn't even make it all the way home. They got to turn around and then we got to put him back together again. So I would say trauma directly to the area is the big thing, but you shouldn't need to really rearrange your house a whole lot for that. And then what was the other half of that question? Anything I should buy before surgery? Not necessarily, unless if you know you have a pet who's really, really prone to licking, then maybe leaving the office with a cone, or they do sell special surgery recovery shirts that you can buy if you hate cones. They're different than just putting a t-shirt on them because it's actually waterproof and breathable. So your pet can lick the outside of the shirt, but it will keep the incision and everything safe and protected from scratches and things like that. I just ask that you definitely do take it off at least once a day in order to look at the incision and make sure it is healing well. So that would be something, if you're concerned, that you could definitely pick up. But vast majority of the pets that we do here actually don't lick. We don't automatically send cones home with anybody, and they do really, really well. We just ask that you kind of keep them calm. So just to kind of wrap up, I know we started out with talking about Bailey, who was our pyometer that came here. Because we had some issues in the beginning of making sure that I was actually logged in correctly on the correct live, I'll kind of recap really quick with Bailey one more time. As she was a really sweet dog. She had a really life-threatening condition called a pyometer, which is an infection of the uterus. We ended up having to do emergency surgery on her. Last we heard, she's doing well at home. She's recovering really well. But she could have avoided a really scary, life-threatening day with a simple procedure if we had just simply caught her earlier before this happened. Surgery goes a lot smoother, is a lot easier, and is a lot less risky if everybody's healthy and happy and doing well. So that's why we encourage that for sure. We actually do see a decent number of PIOs in our line of work, especially in our older girls. So it's something to definitely keep in mind as far as that goes. So I definitely want to thank everybody for coming. And then I just wanted to mention, I was told to mention that the online pharmacy has those pet shirts I talked about for surgery recovery. It also has a lot of the other things that you can look up that we don't necessarily stock here in the clinic. Lots of really cool things associated, pill pockets. You can put your pills in for your pain meds, the waterproof shirts for if you really don't like cones, as well as a plethora of other products that can definitely help you to take care of your pet better and keep them as happy and comfortable at home as possible. And then I'll also want to mention that we do offer what's called Barn Cat Days twice a year. These are discount spay neuter days just for cats, because as I mentioned before, we do a lot of barn cats here, and we are trying to help kind of keep the populations down, which will help minimize disease risk among these populations in the barns. And so it's a 25% off on cat spays and neuters, and we do it in February and also in November, typically the first Thursday of the month of those months. And last thing I'll let you know about is that next month, we're going to be talking about dentals. Okay, so dental disease is something that we see a lot here. Pets have teeth too is a tagline I've seen a lot, and it definitely does apply. They do need dental care as well. And we'll dive into all of the complications you can get with bad teeth next month. So watch out for that. And thank you for coming.